Well, thank you, Madam Speaker. First, want to start by thanking Congresswoman Beatty for that very kind and generous introduction. We in our class are very proud of our colleagues, and we support each other in times of need. And I'd just like to also congratulate and acknowledge Congressman Hakeem Jeffries, the gentleman from New York, who is also host of this special order. I appreciate the opportunity to discuss an issue that is very personal to me. Before I begin, I just want to say that my heart goes out to the families and friends of the victims of the horrible tragedy in Orlando. And I can only imagine what they're going through. The other thing that's very illuminating to me is that as we came here and stood up for a moment of silence, after that moment of silence, I believe members were given a 1-minute opportunity to speak on any topic that they'd like to on the floor, as is customary. And not one person from the other side of the aisle mentioned what happened at Orlando. So not only was it a moment of silence for the leadership in this House, but it appears that it's going to be a moment that remains silent, or a topic that remains silent from the other side of the aisle. Madam Speaker, eliminating racial-based health disparities depends on our ability to advance access to affordable health care for all. Even in the 21st century, health disparities are stark, especially in the African American communities where life expectancies are lower and infant mortality rates are higher than among whites. Today, despite improvements in overall health in the United States, African Americans and other minority populations lag behind in numerous health areas, including access to quality care, timelines of care, and health outcomes. For years, the Congressional Black Caucus has called on Republicans to join us and other House Democrats in developing a plan to eliminate racial health disparities, a plan that addresses the causes of health disparities, such as inequities in the environment, social and economic conditions in our communities. Instead, we get from them proposals like their so-called Better Way poverty proposal, a stale repacking of failed policies presented under the guise of concern about Americans trapped in poverty. Cutting job training programs, food assistance, and Head Start will push low-income Americans further into poverty, making it even more difficult for them to access the affordable and quality health care needed to secure their well-being and the well-being of their families. We need to instead use government as a source of good. Every American deserves to live in a safe and healthy environment. Yet, low-income and minority communities are much more exposed to high levels of pollution, resulting in serious health problems such as asthma, heart problems, and cancer. This is a very real problem across America, a very real problem in my district. 13 million people, including 3.5 million children, are concentrated in the vicinity of transportation facilities and are exposed to unhealthy levels of air pollution. My district is the home of Port Newark Elizabeth Marine Terminal, part of the Port of New York and New Jersey the third largest port in the country. According to the EPA, 25% of children in Newark suffer from asthma, 3 times the state average. What we need are additional federal actions to reduce harmful air pollution from ports and congested components of the national freight transportation system. This issue is critical to the low-income and minority community who suffer the disproportionately adverse health effects of these environmental hazards. Now, since I'm on the topic of environmental justice, I just want to remind everyone that the Republicans continue to block any action to help the thousands of children facing lifelong damage from drinking water poisoned in Flint, including a vote to block families of Flint act in emergency supplemental way. Their radical refusal to address this health issue will have tragic consequences for families, and I think it is representative of their overall inadequate approach to health disparities in minority communities. The way to eliminate racial health disparities is neither to downplay them nor cut programs that will assist the most vulnerable. It is to address the environmental and social and economic conditions that exacerbate those disparities. It is to expand access to quality health care that could eliminate or reduce the onset of many of these chronic illnesses and disproportionate health outcomes. It is to maintain and strengthen our investment in health care access and resources for disadvantaged populations. So in closing, Madam Speaker, I also want to stress health education must also be a focus in any efforts to eliminate racial-based health disparities. African Americans and other communities are disproportionately affected by poor provider-patient communication and health literacy issues. Consequently, they often do not have the access to information that enables them to make the appropriate health decisions. We have a responsibility to work with our healthcare institutions and community health centers to make it easier for people to find and understand and use the information and services. As co-chair of the Congressional Men's Health Caucus, I have hosted and participated in a number of outreach events in my district to engage directly with constituents about the importance of making positive health decisions and staying proactive about their health and well-being. So I encourage everyone watching at home to get the information you need to make smart health decisions, to get the security you and your family deserve, to get the health care that we all need. And with that, Madam Speaker, I yield back.